I want to hand things over now to Melissa Hicks. And Melissa, I will just sit here quietly. But I wanted just to say that, you know, the reason why we wanted to do this panel was to have a discussion about how we can bring this idea of everyone included or in diversity into medical education in terms of diverse stakeholder mix. And how we can do it. What are the challenges? What are the opportunities that could exist for this? And I wanted, you know, to share this discussion with the audience. And I'm happy to also run around the room with mics if you, as a moderator, would like me to do that. I am at your disposal. And I will say that we're right on time. It's 9:50, and that we have a break in about 30 minutes. So. 30 minutes for the panel.
Everybody have mics turned on? All right. So like you said, we're going to talk some about partnering with patients in medical education and how that might advance patient-centered outcomes research and comparative effectiveness research, and how those then contribute to shared decision-making. PCOR surveyed some clinicians and found that only 22% were familiar with the phrase comparative effectiveness research, even though most of them agreed that it would be helpful to make treatment decisions with a patient. So we really need to increase awareness of that. And one place we can start with that is in our training of physicians. So we're going to talk about how partnering with patients in medical education can advance patient-centeredness in medical education. And I'm just going to start with asking each of you to introduce yourselves briefly. So Hugo, take it away.
Yeah, hi, everyone. Speak loudly. I will bring it down a notch. I'm Hugo Campos. I'm a person living with hypertrophic cardiomyopathy, a genetic type of heart condition. Let's see. I am involved on some research projects, and I'm somebody who's actively always looks to sign up for research and to participate in research, because I find it there's always something to be learned, information to be gained, and a lot of times I find very valuable that there's access to clinicians and researchers and doctors in academic institutions where I would otherwise not have access to. I find that very valuable. So that's me.
Let's see. Oh, there we go. My name's Heather Davidson. I'm an educator. My training is in psychology. And I direct an interprofessional program at Vanderbilt University. So we put medical students, nursing students, from Vanderbilt. We collaborate with other universities, Lipscomb University School of Pharmacy and University of Tennessee Master of Social Work programs. We put these students on teams together and put them in clinics, and they're with us for 2 years where they interact through seminars and simulations. And it's really been a joy to see these early health professional students with their passion come together and learn with each other. And I'm also a patient and a family member myself, and so I find myself, as every year I grow older and have more experience in the healthcare system personally, that I tend to bring all of those things to how we're thinking about developing curricula, the gaps that my family members tell me about, or the frustrations that I personally have. And so one of the things that keep bringing us back to the topic at hand is I'm trying to figure out ways in which to, and I love the word elegant, not efficient, but elegantly get more patients involved with our educational program. So the last 2 years we've invited community members who serve on the patient and family advisory boards of our 2 children and adult hospitals to join us. And I can talk more about that later, but anyway, that's me.
My name's Lailani. I used to be a person living with hypertrophic cardiomyopathy. I'm now about 2.5 years out from heart transplant. And I have had the distinct pleasure of being an e-patient here and teaching as part of Stanford Institute's summer program, and then also in Stanford medicine classes. I also serve on the Patient Family Advisory Council for Stanford Healthcare. So as someone who grew up with a chronic condition but never really felt like a true patient until several years ago, I've found that my best experiences in healthcare have been when I've had the greatest resources. And I think that's composed of two things. One is access to humans, and then the other is access to data. And the human piece, I think, is those best interactions have come from people who had the patient experience or empathy training instilled at the beginning of their training. So it's been very impactful for me to be able to talk to people about my experience, especially when they're just starting out in medicine.
Hello, my name is Anika. I'm a high school student this year. I'm a senior. Can you hear me now? Oh, there we go. Much better. Hi, my name is Anika. I'm a senior in high school this year, and I was a former SASE student, and I'm also pursuing research under Medicine X. We're looking into patient-physician interactions within the Parkinson's community. So we're kind of analyzing our large database of e-patients within the Parkinson's community and their experiences dealing with their specialists, and kind of like looking at trends that mark kind of the reason why there could be the reason for initiating a larger e-patient community within the Parkinson's community. And yeah, so that's kind of what we're looking at.
Great, and so I'm Larry Chu, the Executive Director of Medicine X. One of the programs that we do as part of Medicine X is our summer program, and the acronym for it is SASI, which is sassy. So, so while Anika is a sassy student, it is actually, the acronym is for the summer program, the Stanford Anesthesia Summer Institute. And in that summer program, we want to live our mission. So we bring our e-patient experts who've been through Medicine X and been in our programs in as Stanford faculty. And they teach in our summer institute at Stanford. We've been working to bring patients into all of our classes that we teach at Stanford. Not just our summer institute, but our year-round programs that students in computer science, engineering, medical students, computer science take with us on campus. And so that's a little bit about me.
So I'm Melissa Hicks. I'm an e-patient scholar and was also on SASE faculty along with Lailani and Hugo. And I've also done some work with ACC&E in continuing medical education. So Anika, why don't you talk a little bit about your experience with SASE and what you were expecting versus what you got, specifically in terms of involving patients in the program?
Yeah, so when I first walked into SASE, I was actually, a couple years before, I was in Medicine X's High School Scholars Program, where that year, a select group of high school students were invited to attend Medicine X conference. I think it was the one in fall. So going into SASE, I kind of had a perspective of knowing that there is going to be a large interaction with a larger patient community, and that's kind of what was really appealing for me, because when I first got introduced to it through the High School Scholars Program, it really did blow me away, because going into Medicine X that time, I never really saw myself getting an interaction with patients, but after my High School Scholars experience, I knew that I needed something like this going on if I hoped to pursue medicine. So SASE really did provide that for me, and interacting with amazing e-patients like Hugo and Melissa, I really got to learn the insider kind of perspective that you wouldn't really get from talking to physicians or researchers. Because I remember Hugo sharing his stories dealing with some of his specialists. He was just so amazing, and he made everybody laugh. And I think I loved Hugo's presentations and like interacting with him. He was just so amazing. It kind of gives you this kind of perspective that there's more to medicine than just physicians and research and finding cures and medications, that it really deals with this collaborative effort between a patient and their physician, and that's the most important thing in medicine. It never is like the dosages of a medication or what treatments are available, but that collaborative effort of understanding the patient, understanding and having everything on the table just as is without hiding anything or hiding any information from either party. I think that collaborative effort is what is essential to medicine, and that was my key takeaway from SASE. And I could not ask for anything more, because I think it was something that was it really strengthened my interest and my passion in medicine.
Thank you for mentioning. If I may add to that, Anika, it's and I'm sure everyone else who's been a part of the program as an e-patient can attest to this. The experience has been equally rewarding to us as patients in the program. The level, the amount of eagerness and enthusiasm that Anika and her fellow students showed, if I was excited about being there, it was primarily only really because of the excitement of the students who participate in the class. And I think it gets to the core of what's really special about this, which really is this opportunity to create empathy and this opportunity to really understand what the future doctors go through, which is hard. It's not easy, and to go through medical education and years and years and years and years of studying and training. And I can say that it sort of gives me an appreciation for the other side. So it becomes not just doctors versus patients. It really becomes it's sort of this notion, this idea of people helping one another achieve their goals, and it's just a wonderful thing.
Yeah, I agree. I think before going into the program, I had a very strict Silicon Valley kind of perspective. I'm from San Jose. So a lot of everything is just technical work, getting research, getting internships. That's kind of how my perspective was. But after going to SASE, I kind of added a little bit more human element to myself, and it really helped me grow my character and become the person I am today. So SASE was very impactful for me.
Lailani, could you tell us a little bit about your experience as faculty in that program?
Absolutely. So it was so cool to me because I was speaking to people like you who have had an interest in medicine but haven't yet, for lack of a better word, maybe been jaded by the system. And so the enthusiasm was phenomenal. And it was, I probably being one of the younger members of the faculty, no offense, I remember very strongly being in high school and trying to figure out what was for me. And, where was I going to devote the next 4, 8, 10 years of my life to? So it was really phenomenal to be working with students who were just trying to figure that out and trying to understand the breadth of medicine, because I think, like you said, I also grew up in Silicon Valley, and we tend to focus a lot more on health tech here, which is equally important. But I think instilling the patient voice and the patient experience at such a young age, I found it really validating to be able to share my story, and then also rewarding to hear that it was impactful to some of the students.
So do any of you, the three of you, have thoughts on why that all went so well for you, or feedback on what might have gone wrong?
I think for me, Sassy wasn't just like a regular internship, because we didn't only focus on medical tech or having presentations and stuff like that, because we also had a lot of workshops for college and other aspects of life. And Dr. Chu and Salima, they were just so approachable, and we could honestly talk about anything. So it was more of this family kind of interaction that made it so rewarding and so personal, I feel like. And that's what made it so successful, is that you kind of could relate to the people talking, and you can talk about anything. And that's why I guess I could, and a lot of my cohorts could connect so well with a lot of the faculty.
I also appreciated, I come from an arts background when I'm not doing health, and I appreciated how interdisciplinary it was. You know, I was able to get up and share my story. We had the e-patient video that had been so phenomenally well produced. And then right after I shared my experience, Hugo came up and shared all of his medical devices, and you know, people were able to touch, they got the tactile feedback. So as a lifelong learner, it was so cool to see that there were different styles of learning that were included just in one day, and then different forms of education that were based on bringing a holistic, even arts approach to the classroom.
You don't have to.
It was wonderful. I can't even, you know, I keep thinking, what could have gone wrong? And I can't even think of what could have gone wrong. I mean, it was such a good environment, and it was such a good experience. I think of, you know, if we hadn't not sort of, it's scary, right? I mean, it's not easy, and I thought one of the thoughts that I had was like, why would people be interested in learning about pacemakers and implantable cardioverter defibrillators? It's interesting to me because I live with a condition that requires that therapy, but it may not be interesting to the. So I'm glad that so perhaps that could have been like, no one is interested in learning anything about cardiac rhythm. But it wasn't so. It was, folks were very interested. The students were. It was a great experience. Yeah.
I think for me, being treated specifically as faculty, as opposed to the guest that came in just to tell her patient's story, was huge. I felt very respected by staff, by students, by the rest of the faculty. It was a very comfortable experience. And as a patient, when you go into any event, you never know what kind of reception you're going to get. And so I really appreciated being placed like on the same level as everyone else. That helped a lot.
Including the white coats.
Yes, we all got white coats, felt very, very official, and received photos at the end, signed by the patient or the students. It was really, they took good care of us.
And something not to improve on, but something I think to dispel that's important is that, you know, I think at Stanford we have this aura of being, you know, just the pinnacle, which I agree with, but this kind of program is accessible. I mean, I don't think, I mean, obviously you need funding and you need, you know, people who are invested in it, but I don't think it's something that is just like we can exclusively do. I hope that people will take this model and apply it to their own institutions, because you really only need a couple really dedicated people, and then the ability to bring in students. Like, I think if I had any criticism is I wish we were able to reach more people.
I may actually piggyback on that, because when I was sitting in the audience several years ago and then talking with some of the e-patients here, I mean, as an educator, what kept going through my head was, how can I make this happen with our programs back home? And I wanted to tell you that it is as easy as figuring out who your patient and family advisory council folks are. Meaning, I went back to Vanderbilt and said, who are the directors of our patient and family advisory council? I'm going to ask them out for coffee, and I'm going to start talking to them about being creative and see what we can come up with. And it's also as difficult as being diligent and making intentional relationships. So this took a while of talking, discussing, building trust, just like we talk about in a client or patient room. An educator, me, going into organizations that were already established and making sure they knew they could trust me that I would be a good citizen, a good shepherd to the folks that they had gathered who really wanted to make change in healthcare. And it was over that period of time of just saying, let's be creative and figure out how we can actually invite people in to work with the students, that I think then became our patient and family partnership initiative. And one other thing I was thinking about, so I guess my whole point is, any of you who are working with education and building curricula, this is a door open that you can walk through. And it's as easy as building relationship and as hard as building relationships are, right? But it is possible. It's just you have to go and meet people and establish trust and start that sort of creative process of figuring out where might it fit in our curriculum that's meaningful. And so what I was going to build on what you said is that one of the very simple but very powerful, I think, structural pieces that we built in is, so our second year students all work on quality improvement projects together. So again, these are medical, nursing, pharmacy, social work students that are working on quality improvement projects for the clinical environment they're in. And we thought this would be a great spot to bring in patient and family members to partner with the students so that they could actually give their feedback and think about how they can give that perspective and bring it. And so one of the very simple structures that I put in place was that I huddled with the patient and family community members, right? So I had lunch for them, and we had a nice hour to 90 minutes where we just talked. I gave them, the insight about the program, what the learning objectives were, how I had set up expectations with the students. I made them feel comfortable. I opened it up for them to tell me what their concerns were, and we debriefed each time as well. And so, but having that space to say, no, you're welcome into the educational world, and we want you here, and you are part of the education team, was really important. And that was lunch. I mean, that was just like, let's set a time and let's get some food and let's have a welcoming conversation. So as the director of the program, I can say, you are welcome here, we want you here, and this is the expectations that we have. And so it was like a mini training. So I think I just wanted to make sure, because I think those are those little things that end up being really powerful, but we sort of forget about in our busy world of putting things together. And we say, oh yeah, you're welcome, just come and sit and like jump in with the students. But there's a big gap in terms of like, are we welcome here or not? And the students also being like, what are we supposed to do? And so setting those expectations for relationships, I think, are really important if you're going to go back and establish something in your own educational programs.
When you decided that this was something you wanted to bring into your program, did you get any pushback from administration or leadership, or was everyone on board right away and thought this was just a great idea?
I didn't ask. I just sort of started. Yeah. No. There was no pushback at all. I think that it was more, I knew that as an educator and essentially the administrator of the program, I just needed to start, right? Like I just needed to start building that. And of course, our faculty were really excited about it. And, sort of people just came on board. But I think that's, I bet 100% of the people in this room are people who are self-starters and have started things themselves. And so you sort of know, you just have to sort of take those steps and start moving. But no, people did not push back on that at all. In fact, I think in the end, it's been one of those things that they're like, all right, we can practice this skill of sitting down with other humans that I'm not responsible for caring for, right? I'm not on your care team. We're actually coming to as humans to talk and critically look at a quality improvement issue in a program. So, yeah.
Dr. Chu, you've worked with all levels of medical education. You've done pre-med high school students. You've done continuing medical education for practicing physicians and everything in between. So can you talk a little bit about your experiences with integrating patients into those programs and some of the differences in terms of the levels?
Yeah, I think in my view, there shouldn't be a context where patients can't be integrated into medical education and contribute in meaningful ways as partners. And we, as educators, should view it as gosh, what a tremendous gift and opportunity to explore this new area that we have in front of us. And I guess I'm lucky enough that, you know, I teach in the anesthesiology program, so I teach medical students and I teach residents, and I have postdoctoral fellows, and I find ways to include patients in all of those areas. And then kind of like what Heather was saying, I'm a self-starter and I'm scrappy, so that means where there's an odd opportunity, I create it. So we then started our SASE program for high school and undergraduate students. And you make the opportunities that you don't have, so that you can try to see how patients and caregivers can innovate in this area. I think in terms of challenges, the closer you get to the clinical point of care, obviously, the harder it is to get time. So that's an issue when you don't have time. It is harder to find those opportunities to bring patients in. But you, again, when you're scrappy, you make opportunities. So I'll give you a couple examples, and I'll end with one funny story. So I'm revising my textbook of anesthesiology. I wrote a textbook, and I had to fight with the publisher because they wanted me to cut chapters because it was too big, and I guess paper costs money. So, but I insisted on adding one chapter, and the chapter is going to be the first chapter of the book, and it's going to be written by a patient, and it's going to be on patient-centered care in anesthesiology and the patient view of the journey of anesthesia. And that will be the first chapter that anyone reads in a book about anesthesiology. And well, why isn't that the first chapter of every book, of every specialty? It's so obvious to me. But we create the opportunities. And then I guess the funny story that I'll tell is that it's a gift and opportunity because I'm learning all the time. And and I hope I have permission to share this story, Hugo, because this is when we were getting in trouble together during SASE. But we were teaching the cardiac module, and we wanted to show the students how to do a 12-lead EKG. So we wanted to borrow an EKG machine from the cardiac clinic. So I asked Hugo to come and help me borrow this EKG machine. And so Hugo came with me wearing his faculty white coat to the cardiac clinic where, had you been seen there?
Yes, I had been
So
seen
he
there.
had been seen there.
Over many years.
Over many years. But we go in the back door, the clinic, the clinician's door, and I just was seeing the excitement in your eyes, which then I became excited. And I'm seeing this clinic through the eyes of Hugo, who's been a patient here. And I remember everyone looking at you differently too. And we're here on serious business to get this EKG machine, and the tremendous perspective shift that brings. And for me, I was just thinking, gosh, what an amazing opportunity for learning on both sides when we can come together in real partnership. And then, and in this back of the house way to really talk honestly as colleagues, right? But why can't we do that all the time? So that was one thing that I learned from our little escapade there. We did get the EKG machine, and so yeah, I think there's always challenges. This is not necessarily easy, but the journey is enjoyable and always learning.
And I think like piggybacking off of the idea of like creating your own opportunities, SASE gives you so many opportunities to, build your own kind of, build your own kind of life. I know that when I was in the SASE program personally, I had this interest in Parkinson's research, and the whole community in and of itself because my grandmother did pass away with Parkinson's. And I remember going to Dr. Chu and talking to him about it, and here I am now doing research in Parkinson's with Jasmine and so many amazing e-patients in the community. And beyond that as well, we got opportunities to go to Changemaker conferences and attend Medicine X almost 2-3 years now. So Sassy does give you that opportunity to make what you want of it, and I think I made the most of it. And full circle coming back to it, I get to mentor this year at Sassy, and it's the most rewarding thing ever because I had some great mentors that helped me throughout my Sassy journey, and now I get to kind of give back. So it's just really amazing.
Should we take? Let's take a couple of questions from the audience. Do you want to?
Thank you. Congratulations with a fantastic initiative. And the question that came up for me is, how can we do this, bringing patients in with people who are less educated and poor and may not have the conversational skills that we have in the panel before us? I'm asking this because I worked with Riva in a diabetes clinic for the poor in Bangalore, and in the outskirts of Bangalore, where people barely have a roof over their heads, and the floor is made of cow manure. We did it with the Pascua Yaqui tribe in Tucson, Arizona. Very poor people. We did it in a food desert right in New York, where we live in Brooklyn, in the Bronx. And we found on all those occasions that we learned so much from them. And there is something biologically in us that when we experience the other person as the same, empathy comes quickly, more natural. But when there is huge differences, including in class and status and education, it's more difficult to empathize. So I so much admire this initiative. And then this question came up, how can we bring in to this program, this initiative, people who are poor, less educated, less privileged, because they have a lot to teach. How could we do that? Thank you.
I have a short answer on that, and I think it starts with you. You know, the first time I was asked to speak at anything like this was from my anesthesiologist during my procedure, and we had met for maybe, I don't know, a minute before I went under, and then she came into my hospital room a month later and said, hey, I know that you had survived being on ECMO, and I've never really talked to anyone your age. And so we hadn't had any formal relationship with each other where she knew my background or anything. So I think it just starts with, if you meet someone who you found that you've connected with, I think you bring up a good point that it's often harder to build empathy when we have inherent differences. But I think if you asked any one of those people whom you've met to come back into the clinical setting and assure them that they're not there for tokenism, they're there to help as a peer, that's so fundamental to making sure that everyone is coming together on an even playing field and hearing each other with the same amount of respect.
And if I can add to that, I think it's what I think Medicine X has done really well and does really well is take folks on a journey, patients, right? So many years ago, I wasn't as activated, and I perhaps wasn't as eloquent in telling my story. But over the course of the years, I've learned how to tell my story. I learned what mattered to doctors to listen, to others to engage in the best way. So I think it's more about recognizing where the potential is, and I think Dr. Chu has done an incredible job in nurturing many of us along this path to becoming more able to participate in ways that are more meaningful in medical education, in the healthcare system, It really is about elevating health literacy. And we all, when I started on this journey, mind you, I knew the heart had 4 chambers. That's all I knew about anything. And so folks can learn, if people can learn, and if they're motivated and interested. So I think finding who the persons are in your universe, who should be and can be empowered and lifted, and look for those opportunities. That's what I would say.
Yeah, and what I would add too is remembering our nonverbal communication and practicing that too, because education levels and language and vocabulary separate us a lot and can sometimes get in the way of actually relating as humans. And I challenge myself on that too, in terms of how can we, without using words, show each other that we are open and want to build trust, right? And we do that when we walk into other countries where we don't know the language as well. And I'll tell a story in this because one of actually the posters that are going to be shown is about the Camden Coalition Hotspotting Initiative, and this beautiful story that one of the students from Vanderbilt, or from Lipscomb Pharmacy, actually part of the VPEL program too, talked about was that she went to see one of the patients that she had been connected to, who was in a skilled nursing facility. He was on and off homeless. And so the first time she went to meet with this patient as part of this advocacy program, they didn't say anything. I mean, she just sat with him and watched the TV that was on. And she said, I remember as a student, I'm thinking, what should I be doing? What should I be doing? What should I be doing? And so, but she just sat. And then she left. And the next time she came back, she sat again. And I forget if it was the second or third time that it happened, but it did happen. He started talking to her. And all of a sudden, he started telling her the stories that she was desiring to hear so she could think about how she could add assistance and help. But it was sitting, it wasn't talking, it was sitting, it was presence, it was nonverbal. So I think that we collectively need to all practice how we use our nonverbals in which to get over those barriers that we often find with education level or just pure language or vocabulary or jargon. And that's, I think, something that we all can do just as humans and is so helpful.
I think too, I think your question has multiple parts, one of which is where do you find these patients? And the answer is if you find one, you ask for referrals. They will help you find the other patients. The other piece of it is you ask them what they need. You ask them, how can I make this a better experience for you? What barriers are there? If you're not able to participate in this program because you need to be at work, can we pay you for your time? Can we do it at a time that works for you? Every patient has different needs, and every community has different needs, and asking the person who has those needs what they need is the way to solve for it.
Okay, so we're at time. We're gonna have one more question, and then we'll wrap up. And then I'll add my little answer, because we have to go longer, right? I remember advice that Eric and Amanda Briegel gave me last year, and they said, you'll have to come out and visit us on the reservation where they work. And it's not always about asking people to come to you, but you can meet people where they are. And that is also honoring them and understanding their community and understanding who they are. So that's also something to consider. But let me have Liz Salmi ask the last question, and then we're going to go on a break.
Thank you for this great panel. As part of the title for the panel, it says Advanced Patient-Centered Outcomes Research and Comparative Effectiveness Research. And just curious about the work you guys are doing, if it's resulted in any research partnerships or ideas or inspirations for research.
So when it comes to research, yes, it opened a lot of doors for me in the sense that I got to collaborate with a lot of the e-patients within the community and get a lot of different perspectives. And in addition, I got to collaborate with like a large group of people, especially when it comes to Parkinson's. I think for me, the best answer to that question would be that research, when it's surrounding patients, I find that through Medicine X, it really inspired me to look into interactions rather than just, kind of like patient outcomes in a certain treatment. I think those interactions are what really, in my opinion, really matter to me, and kind of seeing the collaborations. That's what I'm really interested in.
I think that there's also just a normalization of patients being involved in healthcare. If you're in a class where you have patient faculty, then it probably doesn't seem like a leap to you at all to involve a patient as a researcher on your project. And so just sending that message, again, at all levels of medical education, that patients are partners, advances patient-centered research as well.
Well, I want to thank the panel for a really interesting and engaging discussion. And I hope this frames for the audience the rest of the conference and the days ahead. And as a reminder, we are going to go on break now, and the breakout sessions will begin at 10:50. So you can look at the schedule. There are different breakout rooms. We have workshop areas out here on the deck under the 100-year-old plus oak trees. And we also have rooms inside here. But for now, in the next 25 minutes or so, we have a nice coffee break. And we'll see you in the sessions. Give a round of applause for our wonderful panel. Thank you.